Hi, y'all. Today I wanted to talk to you a little bit about COVID-19 severe illness and how it has impacted Texans. Now, we have learned a lot about COVID-19 since it first emerged, and we're learning more every day. One thing that we've learned is that some people can have COVID-19 and not show any symptoms, but still spread it to other people. But most people do get symptoms, and when they get symptoms, it's usually things like fever and cough and shortness of breath. Other symptoms can also happen, things like headache, sore throat, fatigue, diarrhea, and loss of taste or smell. When symptoms happen, it's often about 4 or 5 days after they've been exposed to the virus. The good news is that most people have a mild illness. Over 80% of people will have a mild illness, but that still leaves about 20% of people. So about 15% of people will develop severe illness and need to be hospitalized. And about 5% of people will develop critical illness and will need to go into the ICU. A lot of times the people that end up needing to be in the ICU are people who have had a lot of lung damage from COVID-19 or from their own immune response to COVID-19. And they have too much trouble breathing and they can't keep their oxygen up, and so they need to be put on a breathing machine, a ventilator. Other people can have kidney damage and need dialysis for some period of time. They might have heart injury or neurological injury or injury from blood clots. And so all of these complications from COVID-19 can be very severe. And people who do end up needing to be in the ICU, about 40 to 70% of them die. And so the mortality rate for people who need ICU care for COVID-19 is very high. Now, we know that this sort of severe or critical illness usually happens it's more likely to happen in certain groups. So people who are age 65 years or older and people who have underlying health conditions. But another thing that we've learned about COVID-19 is that these severe complications and death can happen to anybody. It can happen in children and it can happen in young, healthy adults. And so it's important to know that getting COVID-19 can change your life forever. And giving somebody else COVID-19 can change their life forever. And so that's why we at DSHS keep trying to emphasize those messages to you about ways that you can keep yourself safe and keep those around you safe. And it includes things like staying at least 6 feet apart from people who aren't in your household, and wearing those cloth face coverings anytime that you go into public. Really washing your hands frequently or cleaning them with an alcohol-based hand sanitizer, and cleaning and disinfecting those commonly touched surfaces so that they don't inadvertently spread COVID-19 to people who touch them. And very importantly, staying at home when you feel ill or when you've been exposed to somebody who has COVID-19. And by taking some of these steps, I think that we can keep ourselves safer and we can keep our communities safer. And we appreciate everything that you're doing in your communities to try to keep them safe and healthy.